Good morning, everybody. This is John Kobe. It's a couple minutes before 10 o'clock. Thank you for joining us. We'll get started in just a moment. Good morning again, everybody. We're going to get started in just a minute or two. Lots of people have registered for today's session, and people are still logging in, so bear with us for another minute or two. Thank you. Right. Good morning, everybody. It is now just a minute after 10 o'clock, so people are still logging in. Thank you all for joining us today. Good morning and welcome. My name is John Kope, and with me is Wendy Sager. We'd like to thank everybody for joining us today as we explore the care continuum here at Westminster Canterbury of the Blue Ridge, or also known as WCBR. This webinar is being recorded, so if you'd like a copy of it, just reach out to Wendy or myself, and we'll be happy to send that out to you. And we'll send it out usually within about 24 hours. We've got a copy ready to go. In a moment, I'm going to turn off my video so that you can see the entire screen during the presentation. We'll turn our videos back on at the end when we have a Q&A session. So thank you very much. So sorry for that, a little bit of technical difficulties. We're going to discuss our agenda today. What is the full continuum of care? What is provided in each type of care? Other healthcare services at WCBR. We do have a special guest with us today. Dr. Brad Murray is our medical director. We'll cover what is covered by insurance, Medicare, and long-term care insurance. And lastly, the advantages of Lifecare. So here's a map of our entire campus. We currently have about 57 acres that are inhabited, and it's comprised of mostly independent living apartments and cottages. The part that you see circled in red is our care continuum. The part that is not circled is all independent living. As you can see, the healthcare continuum is accessible to the main building, This design complements connectiveness and a sense of community for residents to continue to enjoy their relationships with their loved ones, friends, and neighbors. A resident will typically move into WCBR while still independent. Roughly 80% of our residents live in an independent living apartment or cottage. Apartments range in size from 640 square feet up to nearly 2,000 square feet. Our cottages range in size from about 1,000 square feet to just about 2,400 square feet. We offer many different floor plans that are beautifully appointed throughout. But our main focus today is the continuum of care support that we provide our residents. This is a magnified view of the care areas from our campus map. WCBR offers a full continuum of care right on our campus. A community that offers the full continuum, like WCBR, has independent living and all other care levels as a resident might ever need in his or her future outside of acute hospital care. That includes assisted living, memory care, and skilled nursing for both short-term rehabilitation as well as long-term care. So why is it important to choose a community with the full continuum? First, choosing a community with a full continuum provides a comprehensive plan for future care needs. And peace of mind for you and your loved ones that you will not have to find a new place to live at your highest level of need. At WCBR, there's another reason why choosing a community with a full continuum is very important. We are a Lifecare community. In addition to providing a full continuum of care, our residents' monthly fees will not increase with a higher level of care. Whatever a resident is paying per month in independent living is what he or she will continue paying when receiving higher levels of care. Westminster Canterbury is the only Lifecare community in this region. All other communities in this area are fee-for-service, where a resident's fees continue to rise as the amount of care that is provided increases. At WCBR, we refer to assisted living as catered living because the care for each resident is catered to his or her specific needs. Our memory support is called Vista. Our skilled nursing care is referred to as health care. And all of our rooms in every level of care are private. In addition to these services, we also have therapy and clinical services. We'll talk about more of those later. In a moment, I'll describe the different levels of care in more detail. But before I do, I want to touch on a frequently asked question. That is, who decides when it's time for a resident to move to a higher level of care? The simple answer is, it's a collaborative effort. It can involve input from the resident, their loved ones, their physician, or a WCBR associate. We also have an interdisciplinary team that meets weekly to discuss the safety and well-being of all of our residents. This team is comprised of several associates such as our social workers, our chaplain, resident services director, healthcare administrator, and finally medical director. The priority always is the safety of our residents and their quality of life. It is the basis for all decisions about whether the most appropriate placement is in healthcare. Lastly, this is a great time to point out the difference between the way a not-for-profit community like us, WCBR, and a for-profit community view these types of decisions. A for-profit community views an empty care room as a loss of revenue, and their goal is to increase profit by keeping the rooms full, in which case a resident may not have a room when they need it. Not so here at WCBR. Because we are a not-for-profit, we guarantee that our residents have their own private room in any level of care whenever they need it. As I mentioned previously, we refer to assisted living as catered living. Catered living is appropriate for an individual who would need assistance with his or her activities of daily living, such as bathing and dressing, or help with medication management. Meals, transportation, and programming are also provided. Regarding programming, every care area has its own activities coordinator who provides and arranges a daily schedule of events and activities. One additional feature of catered living is the availability of respite rooms. These are furnished rooms where a resident might stay temporarily while recovering from an injury or illness. For example, let's say a resident sprains her ankle and is having difficulty bathing, dressing, or getting around. She could come stay in a respite room so that we can provide the care she needs until she can go back home to independent living. There is no additional charge for respite stays for a Lifecare resident at WCBR. It's all included in monthly fees. And last but not least, WCBR has earned the Hearthstone Institute's Engaged Life certification, making us the second organization in the entire nation and the first in Virginia to earn this distinction. The Engaged Life program was implemented in catered living in the fall of 2022. It includes components aimed at creating a stigma-free, dementia-friendly community that honors and values each individual wherever they reside. This program includes associate training and special programming that expand opportunities for fulfilling engagement across WCBR's continuum. At WCBR, Vista residents enjoy private accommodations and the full-time services of staff specializing in dementia care and the psychological and emotional needs related to memory loss. Vista provides a home-like environment, including living and dining areas and a beautiful garden courtyard. It's a safe environment specifically designed to reduce anxiety and also to promote a feeling of well-being and purpose. Like catered living, Vista residents receive daily assistance with medication management, bathing, dressing, personal care, housekeeping, and laundry. In addition, WCBR has implemented the I'm Still Here program developed by the Hearthstone Institute. I'm Still Here is a philosophy of dementia care based on the belief that every person living with the disease can continue to experience a high-quality, dignified life. This philosophy directs the programming for and interactions with each resident living in Vista by providing ways for them to continue to live thoughtful, meaningful, and engaged lives. WCBR is proud to be a certified Hearthstone Institute I'm Still Here Center of Excellence. In order to achieve this designation, an organization must make a commitment to participate in rigorous training and implementation of this exclusive program. Skilled nursing care provides the highest level of care without being in a hospital. It includes both short-term rehabilitation and long-term skilled nursing care. Short-term rehabilitation generally occurs after a surgical procedure or a qualified hospital stay as ordered by your physician. Long-term skilled nursing care is needed when a person needs more than just assistance with their basic care needs. It is for when 24-hour care is needed or when they require a two-person assist to transfer. In addition to our care areas that I just mentioned, WCBR has additional care and services provided to residents. Our clinic is overseen by Dr. Brad Murray, our medical director, and we'll hear from Dr. Murray in just a moment.
Good afternoon, everyone. Now I'd like to introduce our special guest today, and thank you for joining us, Dr. Murray. Let me get your picture big on the screen here so that we can see you larger. Thank you so much. So joining us today, Dr. Brad Murray. He's a fellowship-trained geriatrician, board-certified in internal and geriatric medicine. In addition to this role at Westminster Canterbury as the medical director, Dr. Murray is also an associate professor for the University of Virginia Medical School. Dr. Murray will be sharing with us today about his role here at WCBR as medical director and more about the services we provide to residents. Welcome, Dr. Murray, and thank you for joining us.
Great. Thank you, Wendy, and thank you, John. I'm here to give a little bit of information about what I and the medical team here do at Westminster Canterbury, the Blue Ridge. and then I'll stick around for any questions that come up after the rest of the webinar. As Wendy said, I am the medical director at Westminster Canterbury. I've been in that position for 3 years. I'm also a certified medical director. That's a certification program from the Post-Acute and Long-Term Care Society of these United States. It gives me extra training in some of the details and challenges of being a medical director in a skilled rehab environment. I've been in this position for 3 years. I'm a University of Virginia employee, and maybe more importantly, a Charlottesville local. We're part of the section of the University of Virginia's geriatrics. A lot of folks may use University of Virginia primary care services or specialty services. We're part of the geriatric section. And as such, we have medical students, internal medicine residents, doctors who are in their apprenticeship training, and we're delighted to have geriatric fellows. Every year we have 2 fellows who learn geriatrics here with the talented residents at Westminster Canterbury, the Blue Ridge, which has been very generous in being a training site. So there's always young, fresh faces around, and that helps to keep us up to date on new medical technologies and studies. And folks here often choose to be involved in UVA studies, or they may take part in some of the partnerships with the medical school, including mentoring medical students. I'm joined in this endeavor by Dr. Ben Cahill, who's another geriatrician who was our fellow last year and joined our team this year, as well as the very talented nurse practitioner Beth Cobb, who sees folks in the clinic as well as on the healthcare floors. And we're a part of the Greater Westminster team, mostly in the clinic is where we spend most of our time, with Fran Brown, who most residents come to see even if they don't want to see a physician, because she's been here for 30 years and knows just about everything. Robert Mosby is a licensed practical nurse, and then we have Michelle Coran, who's the scheduler and administrator. So with that team, we're trying to provide high-level care to the residents with a focus on accessibility. So access, as many of you probably know, is one of the biggest challenges in medicine today. And that's one of the great perks that living at Westminster Canterbury, the Blue Ridge, can offer. So when folks have a problem or think they have a problem or just want to talk about a potential medical issue, they can call down to the clinic, they can pop their head in, they can send an email. There's any number of ways to get in touch with us, and then they'll be triaged essentially. So we know when and what needs to be done for them. If they're having a medical emergency and require hospitalization, we'll mobilize that. If they just want to talk about something, they're not sure they're having a problem, they want a COVID test, they need a friendly ear, those things are accommodated sort of on the spot. So for us, geriatrics is a high-touch field. We have a lot of people who are super functional, really don't need our services much at all, but are glad we're here. But we have a lot of people who may have some chronic medical problems, and when they feel sick, they really need to get care in a hurry. So that's the kind of care we're trying to provide. We're here 5 days a week. The clinic is covered on the weekends by nurses who are employed by Westminster Canterbury. And then the UVA physician team is on call overnight for the facility, for folks who use UVA as their primary care, and for the medical center and assisted living sections. We also try to provide the same level of accessibility to the rest of the care continuum. So John was talking about folks who need some more help and maybe in catered living or memory care, or find themselves for a respite stay on healthcare. Maybe they had a hip replacement and stay there for a defined period of time, or maybe that's where they live because they need some more help with their activities of daily living. Those folks get medical attention from very skilled RN nurses around the clock, and then they let us know when somebody needs us. We also see folks up there on a regular check-in schedule, and it's not unusual to see folks sort of jovially wandering the halls and chatting and checking on one another. In addition to taking care of folks in these care areas, we also have involvement with the rest of the team at Westminster Canterbury. John mentioned interdisciplinary rounding, which our team is a part of. So every week we meet and talk about whether Westminster Canterbury is providing the right level of care for people who may have care challenges, or maybe their family has a care challenge. We pay attention to what their needs are. We hear concerns of family members. Maybe they have a spouse who may need a respite stay. These kind of things are something we go over routinely with medical folks, nurses, social workers, therapists, and administrators, all working for the good of the resident. What we're trying to do from a medical perspective for the residents of Westminster Canterbury is provide person-focused care. Like I said, we have folks who work, we have folks who go jogging every day, and then we have folks who have found that they may be limited by medical challenges over the years, and that's why they sought to live at Westminster Canterbury and take advantage of the medical services here. That kind of care means that we're approaching everybody as an individual. And because we can see everybody at the facility if need be, although some folks keep their old primary care, they may see us acutely or not at all, and that's fine. We're here when they need us. We have the capacity to treat everybody as an individual, each family according to their needs. So while some folks may be very functional, others may need us more. Some folks may want to go see a lot of specialists, and we can facilitate that. They may need aggressive workups for new problems. Other folks may understand their problems and sort of be at peace with them, and they don't want to go out and see a lot of specialists, and they use us for a lot of their specialty care. The clinic can provide memory care services and diagnoses. We provide all primary care, keep you up on your vaccinations, cancer screenings, etc. We provide acute care to anyone. If you think you have COVID or you're having a cough and you want to be assessed, or you sprained your ankle, fell, whatever, we're here to assess those folks. But we also do a fair amount of procedures. So some folks may need a biopsy of a skin cancer. We can do that. We can draw blood. We can look at rashes. We can do joint injections. We can come up with a physical therapy plan with our partners across the hallway who we're always in close contact with. So there's a lot that we can do that's patient focused. Some folks want to talk about nutrition. We can talk about that. And I think that works really well with what John was describing as the Westminster Canterbury Care Continuum, meeting folks where they are, helping them through medical challenges if they need it, and making sure that they're in the right place, getting the right care at the right time. So that's what we're trying to do here with UVA Geriatrics and with our team as the medical directors of Westminster Canterbury. And we sure hope to see you there. And I'll stick around on the chat for any questions. Thank you.
Thank you so much, Dr. Murray. And yes, thank you. And stick around for questions later on that as they come up. Now we're going to talk a little bit more about cost regarding healthcare, of course. Your Medicare and supplemental insurance cover a good deal of your doctor's appointments and prescriptions. But also, Medicare typically covers doctor-ordered qualifying stays in skilled rehabilitation, therapies, and home health. However, they do not cover assisted living, memory care, long-term skilled nursing care, or home care. So how do you pay for long-term care? They are private pay and not covered by Medicare or supplemental insurance. Some people are able to pay for it with their savings, or perhaps have a long-term care insurance policy that can help offset the cost. Benefits of a long-term care policy can vary. For instance, some policies may have a provision for home care, while others don't. Some will provide a per diem reimbursement and others a lump sum benefit. It's also good to learn about specifics like exclusion periods. How many days of your care will be considered uncovered and include out-of-pocket expenses? So your benefits will depend upon your own individual policy. And a very important thing to consider is that your long-term care policy will help you pay for care, but it does not provide the where or the who. You need to determine where you will be receiving care and who will be providing it. If you wait until there is a need for a higher care, you will choose from only the available options. Residents at Westminster Canterbury do not need to worry about whether their future care needs will be met because we have the full continuum of care already in place. And they know who will be providing the care and where they will be receiving it. It will be right in the community in which they live. As we mentioned at the beginning of this webinar, WCBR is the only life care community in this region. Any other continuing care retirement community in this area has a fee-for-service model. In a life care model, your monthly fees will not increase based on a higher level of care. With fee-for-service, monthly fees increase as health needs increase for each person. Because you know that your monthly fees will not skyrocket if you ever need a higher level of care, WCBR's life care model offers asset protection. As a resident at WCBR, you will not have to worry about whether you'll be able to afford the rising costs of healthcare services. There are also tax benefits when choosing a life care community. In our model, you are prepaying for future healthcare needs in today's dollars. So a portion of your entrance fee and a portion of your monthly fees may be realized as a tax benefit from the very first year as a resident. Please be sure to consult your personal tax advisor to better understand your specific circumstances. In addition, you will have peace of mind knowing where you're going to live, who is going to provide your care, and exactly what it will cost. You won't ever have to worry about the huge cost fluctuations based on additional care. And WCBR enhances an active, vibrant lifestyle, helping you to remain independent longer and have more time to do the things that you love the most. Although this webinar focused primarily on higher levels of care, our community offers so much more than care. That's a topic for another day, or you can watch our previous webinar, Exploring the Luxury and Lifestyle at WCBR. This webinar can be sent to you. If you would like us to send that, please reach out and let me or John know. We'll be happy to send that to you. Now we'd like to open it up for questions. If anybody has any questions, please type it in the Q&A section on your computer. See any questions? Also, the chat feature is there for you if you'd like to type in any questions. So this was just an overview of our care continuum. We have these questions a lot when John and I are meeting with people, not only new people who are exploring Westminster Canterbury, but also people who have maybe been on our waiting list for a long time. These questions come up, and so it's good to review this. We're recording this webinar, so we're going to be sending this out to you again. You can watch it again and share it with others, and also those who are not able to attend live will be receiving this as an email as well. Let me just check again, see if there are any questions that popped in. Not seeing any, we will leave it at that. Wish you a wonderful day. Thank you for joining us today. And again, Dr. Murray, thank you so much for joining us. We appreciate all that you do for our community. I can't tell you how much that we hear from residents, how much they care for you and appreciate what you do for them. So thank you for joining us.
Thanks, Wendy. I think I'm seeing some questions here in the Q&A. Are those up to date or is that old?
Okay, now I'm starting to see some pop up. Thanks. I was just ready to tune out here. All right.
So the first question I can handle is exactly how many people on medical staff serving how many residents? 400 question mark.
How many people know?
So 400 is a pretty good estimate of the amount of folks here. We have 2 MDs on full-time medical staff and 1 nurse practitioner, along with the trainees that I mentioned. And then we have RNs. There's usually probably 5 or 6 RNs working on any given day, as well as our LPNs and CNA teams. So depending on where you are in the facility, there'll be a higher ratio of medical staff to residents.
Thank you. And I am now seeing all the questions. Thank you so much for starting that off, Dr. Murray. Okay, next question is from Lori. Will we still need our long-term care insurance if we move to WCBR? That's a great question. I am not a professional in long-term care insurance. I would recommend that you take your policy to somebody who did not sell it to you, who can be an objective voice to really review your policy in light of your premiums. I know that premiums have really gone up lately, but a lot of you have been paying into these policies for a long time. So that's something that I would urge you to seek professional advice on that. But I can tell you how it works here. When you have a long-term care policy, even though you're not paying more when you move to a higher level of care, once you do, our social workers can then provide you the documentation that you need to give to your insurance company, or they can file it on your behalf to state that you are now receiving a higher level of care. That will start triggering your benefit reimbursements that come directly to you. So if you are receiving the type of care for which your policy provides a benefit, that's at the time that you're starting to receive that care, that's what will trigger your benefit reimbursement, again, coming directly to you. And at that point, it can start to offset your monthly fees. So hopefully that answered your question. And I do have, John and I do have a local contact who's happy to review your policy for you. So reach out to one of us if we can pass along that name to you. She's not a Westminster Canterbury employee, just a local resource who does that. Next question is from Susan. What kind of health insurance works best in conjunction with the healthcare available at WCBR? Medicare Advantage, supplemental insurance? Dr. Murray, I don't have any information on that. Do you?
Sure. Yes, I have some information. This is a really hot topic right now for consumers of Medicare, is whether they would be best served by a Medicare Advantage plan or a traditional Medicare with a supplement. As one of the perks of being in the care continuum would be that practically it doesn't make a whole lot of difference in the care you receive. That is to say, one challenge with Medicare Advantage programs is that they may not pay for a skilled stay for as long as a traditional Medicare. So we end up having to appeal that a lot for community residents. But if you live at Westminster and you need healthcare services, it's all a part of the package. As far as outpatient services, that would be something to look at your individual medical challenges and determine whether each plan has advantages for one or the other. But probably what the question is alluding to is that we as a nation may be moving more towards Medicare Advantage plans. They're 50% of the state right now, although only something like 5 or 10% of Westminster residents. So this situation is going to change year to year.
Yes, and one of the services that we provide, Susan, when a resident is moving to Westminster Canterbury, our business office, before the person signs their agreement, before they become a resident, the business office will review your current insurance and let you know what impact you might have regarding any type of out-of-pocket expenses that you might have. So you'll have that information ahead of time. Also, local resource, if you're local, Susan, we do have Jefferson Area Board of Aging has volunteers and also employees over at, we call it JABA for short, who review different insurance plans based on maybe your needs and medications that you're taking and things like that. So they're a great resource, local resource to go in and speak with them free of charge. Terry asks, when one person in a couple needs a higher level of care, but the other does not, how does that affect the cost? And I love getting this question, Terry, because people are not sometimes familiar with the Lifecare model. One of the key features of the Lifecare model is that it does not impact your monthly fees at all. You would be paying, as a couple, you're paying a 2-person fee in independent living. When one person in that couple were to move permanently to a higher level of care, or even temporarily, The monthly fee is not impacted at all, does not change. You're going to still pay that 2-person monthly fee that is connected to your independent living residence. So that is what your fee will be based on. There is an annual cost of living adjustment that takes place on July 1. So that is the only increase a resident will see in his or her lifetime, will be that annual cost of living increase. Because we are a not-for-profit community, our increases tend to be lower than certainly a for-profit community, and has been under industry averages for increases annually. And they have been the last few years about a 3% monthly increase. So thank you for that question, Terry. It's a good reminder for some of those people who are still wondering, how does this impact my fees? It does not impact your fees at all. That's one of the great features of Lifecare. Next question. Hi, David. If a couple does not have long-term care insurance, is that a problem? Absolutely not. Some people have purchased long-term care insurance sometimes long ago, and some people have decided they're going to self-fund their long-term care. And so not a problem at all if you don't have long-term care insurance. Roseanne asks, what is the status of plans of the new building for assisted living and skilled nursing? That's a great question. And we are hoping to have an update from our CEO, Tyler Kendall, in the coming weeks and months. He is working right now with the executive leadership team on formulating the strategic plan for the next several years. And we're hoping to get an update on that soon, and be sure that, especially if you're a Compass Club member, you'll be getting those updates when we get them. So we're standing by for those to find out if that is part of our next phase of our strategic plan. So stay tuned. Great question. Okay, next question from Ann and Hank. In the newsletter, a tour of the WCBR care areas is offered to residents. Is this tour available to Compass Club members? It is. There's a group of residents who are passionate about highlighting our care areas and the health center, and you are welcome as a Compass Club member to reach out as noted in the newsletter to that resident who is organizing those tours. And of course, John and I are happy to give you a tour of the care areas as well. If you'd like a more personalized experience, we'd be happy to set that up with you. Cooper asks, is it possible to visit the care portion of the facility? Yes. Sorry, I didn't read ahead. Scott, when a WC resident visits the on-site clinic, whether for a minor problem like a rash or more serious problem, and the resident has private insurance, not Medicare Part B, does the clinic accept the private insurance as payment? Or for some routine care, is there no charge by the clinic? Can you answer that, Dr. Murray?
Yes, of course. So the clinic is operating just like a traditional billing clinic. We make appointments. It's in the electronic medical record for you to see through My Chart, is the Epic consumer database there. And so your insurance will be billed through Part B if you have Medicare, or for folks that have maintained their private insurance through that insurer. And as far as I know, UVA participates with every insurer. There are things that we do in the clinic that we don't bill for example, triaging and COVID testing and nurse visits. A lot of wound care does not get an appointment in a bill, but for an appointment, there would be a bill through insurance. And that's done through UVA. There was another question that came up. Am I personally billing? No, it's all through the University of Virginia.
Thank you. Marianne asked, if your spouse may need some memory care, is it possible to be admitted for one in independent living and the other in memory care at the same time? Great question, and another question we get asked a lot. The primary way that a resident or a couple would come to Westminster Canterbury is both coming in as independent living. And then we're guaranteeing access to any level of care in the future when you need it. That being said, sometimes I would say that memory care is one that we often do not have availability for someone to enter coming in who's not already a resident. So the goal for someone who is on our waiting list is to move to Westminster Canterbury and independent living before any need arises. Each person must be considered appropriate for independent living coming into Westminster Canterbury, and then you don't need to worry about availability. So the long and short of the answer is usually not, especially for memory care. Nelson asked, can you estimate the number of people living at WCBR and each level of care? Dr. Murray, correct me if I'm wrong. Typically, John and I will say on any given day, roughly 80% of the residents are independent and roughly 20 are in a care area. Is that, you say that's accurate, or do we need to update our answer?
I'm trying to do the math in my head, but we have 75 catered living rooms, apartments, and 12 memory care Vista, and then
it's 45
50,
catered living, 45 catered
sorry,
living.
45.
Yep.
And then 50 long-term care or skilled nursing beds upstairs.
Yeah. And our happy place for occupancy is maybe 80%. And so we're oftentimes, we're doing that because we're providing a buffer in our care areas, making sure that we have space for all of our residents. That's one of the biggest defining features in my book when you talk about not-for-profit versus for-profit, is in the way that we view care areas. A for-profit community's goal is 100% full 100% of the time. And Westminster Canterbury is not-for-profit. And we're looking at, that's what's so important about this interdisciplinary team. We are keeping a really good gauge on availability and guaranteeing our residents a place whenever they need it. And so we do have opportunity on a regular basis in the areas of care. Anonymous asks, how does Westminster Canterbury assure financial stability for our investment? So this is when I wish John were here. We're having technical difficulties today. And so you've just got me right now. So John's really good at answering this question. He's right next to me, so he can whisper the answer to me. So we have available to you just ask. We can provide you with our disclosure statement up to date, and that's going to give you our balance sheet and show you how financially solid we are. And so just to give you an example, a couple of different examples, our actuary partner is A.V. Powell. And we have earned this seal of approval through A.V. Powell dealing with financial stabilities. And the seal of approval is only given to those in the top tier of financial stability. So you've got measures in place, people who we're accountable to make sure that we are being good stewards of the funds that we're receiving. The other thing, another measure that's used in the industry is days of cash on hand. And the industry average is about 200 and some days. And we have, I think, John saying over 1,200 days of cash on hand. And so that means how much money do you have on hand if all of your income ceases and you're having to pay all of your operating expenses from what you have cash on hand. So those are great measures. The person who is looking at the budget is our CFO, Anna Buchanan. She is reporting to residents on a regular basis. She reports on the budget. She reports to the board. And so there's lots of measures put in place to not only ensure that we're financially stable, but also to report this to residents on a regular basis. There's lots of measures put in place to protect us and our investment. So hopefully that answered your question. Be happy to provide you with the disclosure statement as well. Robert asked, does WCBR provide transportation to UVA for medical appointments. Westminster Canterbury, we have a fleet of vehicles and we provide transportation for our residents complimentary within a 30-mile radius. So some of those trips do involve medical appointments. Some of those trips are to grocery stores or to DSW to buy shoes or wherever it might be. So we provide that service for our residents, again, complimentary within a 30-mile radius. Bill asked, what does WCBR, I'm sorry, that's the same question. Bill and Robert, you are on the same wavelength. Next question from Anonymous. What is covered and what is not covered when you go to a higher level of care? This is for those who do not have a one-term policy. Dr. Murray, do you want to speak to that? What is covered and what is not covered?
Sure. So if one goes to a higher level of care that's not associated with like a surgery or a hospitalization, in other words, it's not a respite stay or a skilled nursing stay, then your overhead fees would remain the same. There may be a slight difference in monthly meal fees, but it's fairly negligible. As far as what's billed from healthcare, everything would be continued to go through Medicare Part B or private insurance plans when it comes to provider visits, physical therapy, lab draws, medications. So you basically continue to be an outpatient citizen who's living in a nursing home or a assisted living environment.
Okay, thank you. And this next question is for you as well. We would be coming to WCBR from another state. Will you be able to make recommendations for specialists, eye care, dental, medical specialists, etc.?
Yes, of course. Most folks use their PCP or primary care as sort of their networker or quarterback in this arena, and we are happy to make recommendations either through me or my partners, or even Fran and Robert at in the clinic, and word of mouth as well. So there's plenty of folks around. Charlottesville has an embarrassment of medical riches, and so getting the correct specialist in place is usually not a problem and can be done pretty quickly when you arrive.
Thank you. Last question from Anonymous. Are these care options only available from the start in independent living? I think I addressed that earlier when we're talking about moving into independent living first, and the answer is generally yes. Every so often we do have the availability to move somebody into a higher level of care directly from externally, but that really is based upon availability, and it is not a very common occurrence. And so hopefully that answers your question. We have covered all the questions. Thank you again, Dr. Murray, for joining us today. And if you're in Virginia, it's a gorgeous day, so we hope you get out there and enjoy this beautiful weather. And I'm looking forward to seeing you all next time. Thanks for joining us, and signing off.